All right, welcome to another episode of the Chiropractic Assistant Training Series. And what we're doing is just trying to make it easy to do our jobs, essentially much more efficient, effective, and easier. And the number one goal is patient service. That's the number one reason we pay a lot of attention to this. So we're going to go into today, basically we're going to go into what chiropractors do relative to the 3 phases of healing. And that becomes very important to understand. My staff could essentially teach this to chiropractors coming out of school. And the reason this is so important is to understand exactly what's going on in the office and why it's going on. So let's walk through this, and we're going to go into somewhat of the detail. We're going to go into the 3 phases of healing. We're going to go into what happens in the 3 phases of healing. How does this apply to the patient? We're going to go into also the therapies that are used and why they're used, and especially even the basic testing. So, because all the care that the patient gets is based on their consultation, the information we get in the consultation, which determines their mechanism of injury, all the diagnostic tests. That's what determines essentially the diagnosis. And then the diagnosis determines what the therapeutic protocol is. And then everything is measured. All the therapies are measured, and the response to treatment's measured. And that tells us if the patient is getting better, worse, staying the same, or are they heading toward or ending up with a permanent injury to some degree. So having said that, let's take a look here. So there's the inflammation phase, then there's the repair phase, and then there's the remodel. And we're going to pay a lot of attention to a couple specifics in this. First of all, let's look at the time frames. What's the time frame for the inflammation phase? That can be 72 hours. This can be anywhere from 72 hours up to 12 weeks. Repair phase is 12 weeks, and this is 12 weeks to 12 months, the remodel phase. Now, does that mean that this only lasts 12 hours? No. It does not. And as a matter of fact, that doesn't happen in reality because we live dynamic lives. These do overlap. So let's be clear. A patient will not be only in the inflammatory phase when they're seen by a doctor. They will not then only be in the repair phase. And then they will not only be in the remodel phase. Now, we're going to explain it that way just to make it easy, but there is always overlap because we live dynamic lives. We have to move around. We continue to irritate things. We re-injure things. So, now how we know which phase the patient is in is based on the tests, the different examination tests that we'll do. We can tell by the different tests if there's pain and inflammation. We can tell in the remodel phase with different ranges of motion, and we can tell the repair phase, and then we can tell in the remodel phase by strength and elasticity, okay? But let's be clear, they overlap, and what we're trying to do is get the bulk. So even though the patients, the majority of their care is in the repair phase, there definitely can be and will be some inflammatory aspects to that. So we may do some therapies that are very specific to the inflammation phase that we're still doing and carrying over into the repair phase. And how we'll know that as the physicians is the different tests we'll do. Not only the individual test will do, but the degree of severity of the test. That's what tells us which of the phases they're in and what is the highest probability of phase they're in. Are they in more of this phase or this phase? And so we're always trying to move the patient along. And of course, the goal is to get the patient through all 3 phases of healing and get and to relieve the problem to where it gets back to normal. Or 100% back. That's the goal. Doesn't always happen all the time. Sometimes we can help them significantly, sometimes not as much. So, all right, by the way, and if you're familiar with the statistics of chiropractic, 80% of patients, when polled and surveyed, said they feel 100% better for the problem they came in with. 10% feel that they were helped. They're not 100% better, but they feel like they were helped. There's only 10% of the chiropractic patient who feels like they were not helped for the problem that they came in with at all. So we have really good statistics of helping patients. Okay, so these are the phases, these are the time periods, and what's the other key? They overlap. So we may be doing therapies here, but we also may be including some therapies here. As a matter of fact, we may be doing therapies that are required in the remodel phase, but still be doing some therapies affecting the repair phase, and maybe still be doing some therapies relative to the inflammation phase. It's kind of unusual. Typically, you won't do too much of the remodel phase when you have very much of the inflammatory indicators, but it can happen. In other words, these can overlap. So what are we looking for? Well, we're looking for the peak curve. We're looking for the bell curve, so to speak. Okay, so having said that, so what is the therapeutic goal here? The goal here is to decrease the patient's pain, decrease the patient's inflammation, and to decrease the patient's muscle spasms. Now, it could be more depending on what the patient exhibits, but for the typical chiropractic patient, and remember, 84% of patients come to chiropractors for neuromusculoskeletal back pain, neck pain, and headaches. Another 7% come to chiropractors for neuromusculoskeletal extremity problems. So that's 91% of the reason why patients come to chiropractors is neuromusculoskeletal, okay? So having said that, this is the typical approach therapeutically. Now the reason, pain is easy to understand why to help get the patient out of pain, but here's what happens with inflammation. Inflammation is a cause of pain, is one of the causes of pain. That's why we want to help reduce inflammation. And that's due to an abnormal pH balance in the cellular tissue due to trauma. So we'll get into that a little bit more. And then typically there's a muscle response. Usually the muscles go in there and they try to shut down to prevent more injury, causing muscle tension, muscle spasms. Okay. So as physicians, we're trying to help do this. So that's the therapeutic goal typically right here. Now the therapeutic goal here typically is to increase active, passive, and joint motion. So there's 3 ranges of motion, and I'm sure your doctor is going to go over that if he hasn't yet, but essentially what happens is there's 3 ranges of motion in the joints, whether it's the spine, the elbow, the wrist, whatever. And the active range of motion is what the patient can do on their own. And let me give you an example using my elbow. So if I bend my elbow like this, that's active range of motion. I can only bend it so far. That's called active range of motion. Now, overpressure range of motion requires an external force. So let's say I take my hand. So in other words, I can only contract it so far. But if I took my other hand, there's a nice little bounce there. I'd be able to push it more that I could not do on my own. Now that range of motion is called overpressure range of motion, And that's very important. The third range of motion after that is what's called the joint motion or paraphysiological joint space. That's the third range of motion. Now, what that is when you hear the chiropractic adjustment, when you hear an adjustment and you hear a popping sound, that's that motion. That's called joint motion. And by the way, the popping sound, causes no detriment. There's an old wives' tale, don't pop your knuckles, they'll get bigger, blah, blah, blah. That's not true. What happens is within each joint, there's synovial fluid that acts as lubrication. And when we actually adjust the spine, the joints separate a little bit. And because it's an enclosed area, it creates a negative vacuum. So the liquid nitrogen goes from liquid to a gas state. And what you hear is a pop. That's what you hear. That's what happens. It's going from, that's why after a few minutes, 5, 10, 20 minutes, that gaseous nitrogen, so when the joint's relieved again, the pressure in that joint goes back to normal. Well, the gas nitrogen starts going back into liquid form in a typical neutral state, neutral atmospheric pressure. And that's why maybe 20 minutes later, you could go pop and pop it again. It's just the gas. That's all that is, okay? And it's completely normal and healthy. And there's a lot of other physiological effects going on, but I'm not going to get to that now. So so those are the three ranges of motion. Now, when we evaluate patients, we evaluate all three of them. We'll see how much they can or can't do in each of those three ranges of motion. Because sometimes you can have normal active range of motion, abnormal overpressure, and abnormal joint motion. Or you can have normal active range of motion, normal overpressure, but abnormal joint motion. So, see, they don't all three correspond. And the most important of those three ranges of motion is the joint motion, because that's the fulcrum. In other words, all the motion starts here. Before any of this can move, active range of motion, it has to move here. That's the most important, is the joint motion. So the goal here is to get active, passive, and joint motion back. That's the therapeutic goal there. Now again, these can overlap to some, and they will to some degree. It's not going to be black and white. Okay. Now, the goal here is to increase strength and increase elasticity. And we'll cover that reason why here later. But we're trying to overcome the negative physiological effects of healing. So the goal here in the remodel phase is to do therapies that increase strength and increase elasticity. So, what are some typical therapies here for a chiropractor? Well, typical therapies is the chiropractic adjustment helps to relieve pain, and I'll go into that later. Passive motion helps decrease inflammation. Ice packs help decrease inflammation. Muscle stim helps decrease inflammation. Muscle stim can help decrease pain. Muscle stim can help decrease muscular spasms. Those are the most common therapies that are used in the inflammatory phase. Some other doctors may use laser. You can even use supplements to help with pain, some natural supplements. But that's the typical therapy used for chiropractors in this area. The typical therapy here to increase active passive joint motion is range of motion exercises, as well as chiropractic adjustment. So that's really what is beneficial. Passive motion therapy, active motion therapy, and chiropractic adjustments is what's really the typical adjust. So it could be chiropractic, it could be intersegmental table. So there's a couple different therapies that can be very specific to help increase the active, passive, and joint motion. Now, the chiropractic adjustment is the only therapy that affects the joint motion. So that becomes very important. And remember, it's the joint motion that's the most important motion of all motions, because that's where everything starts, is in the fulcrum. Now you come over here, and the goal is to increase strength and increase elasticity. That helps to prevent a permanent problem with the patient to some degree the rest of their life. Here, the typical therapy might be active resistance therapies. It actually could be exercises. It could be active resistance. It could be a therapy called peripheral neurological facilitation, which is a way to use the nervous system to help increase the stretching and the elasticity. But this is what is typically known as rehabilitation, physical rehabilitation. And there's different methods of doing that. I've just explained some of the easier ones to do. So that's the therapeutic protocol. This is the time frame. This is for the inflammation phase, the repair, the remodel. These are the typical therapeutic goals for the typical neuromusculoskeletal patient. And remember, they typically got that way through major trauma or minor trauma. That's what typically causes the neuromusculoskeletal problems, back pain, neck pain, headaches, things like that. And then we'll do the consultation. The consultation will 75% of the diagnosis, believe it or not, is based on the consultation. Because the patient will kind of tell us what's called the mechanism of injury. What did they do to cause the problem? And that, if you know enough about anatomy, you know that what anatomy is typically involved. Then we'll do different tests. We'll do palpation test, range of motion, active range of motion test, passive overpressure range of motion test, joint test, muscle strength test, nerve test, orthopedic joint test, palpation test, x-rays, and all of these are designed to isolate different aspects of the anatomy. Is the joint involved? Is the disc involved? Is the ligament involved? Is the tendon, the muscle, the nerve, and which muscle, tendon, or nerve or joint? That's what all the tests do. And then we measure them. And the measurement becomes very important because as they get treated, we'll redo the tests, typically every 12 visits. We'll redo those tests, and those tests will tell us, is the patient getting better? So maybe if we did one test and it was a grade 10, and now it's a grade 5, we know it's working. So we're going to keep doing that test. So the quantifying these tests become very important. And then also if we see the patient's not responding, then we go, well, we need to try a different therapy, either get a second opinion, or if all that has already happened and they're already out of the remodel phase and the patient isn't progressing anymore with those tests, we now know it's a permanent injury based on the science of the 3 phases of healing, and that's that. So these are the 3 phases of healing. These are the time frames. These are the therapeutic goals. And we typically know them by the different tests that we do. That's what tells us what the diagnosis is. That's what tells us what the problem is, the severity of the problem. And so that's what our therapy is based on. And then one last thing I'll share with you, the common tests that we'll do with chiropractors, as I shared with you, is we'll pay attention to the symptoms. We'll pay attention to the tenderness. We'll pay attention to the nerve test, the orthopedic test, the joint test, the muscle strength test, the x-rays. See, we'll pay attention to all these tests because, again, they tell us not only what the diagnosis is, but they tell us when we redo those tests, it tells us if the patient's getting better, worse, staying the same, or if it looks like it's going to be a permanent injury to some degree the rest of their life. So let me just leave it like that for now. We'll spend a couple sessions talking about the 3 phases of healing because of how important that is relative to what we're doing in the office. And so you can easily share that with your patients. And then you'll know, by the time we're finished talking about this, you'll kind of know the different tests that were positive, what they mean. You'll know what phase of care they're in and why they're in that particular phase of care and what we're trying to accomplish, and whether or not the person's going to have a permanent problem to some degree. You'll know all of that by the time we finish. So let me leave it like that, kind of keep it short and simple today of starting in. But we're going to do a little series here with the 3 phases of healing, kind of going into a lot of detail, because this is what the main thing that we do. This is the main function of a typical chiropractic office is knowing how to do the diagnostics, matching the therapeutics with whatever phase of healing they're in, and then changing the therapeutics as necessary depending on which phase they're in or how the patient responds to care. That's what becomes so important. And that's what our patient education is based on also, okay? So again, we'll take time, we'll be going into this for several sessions, all right? So we'll see you on the next episode of the Chiropractic Assistant Training.